Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the FIA Group.
Good afternoon. Welcome to another episode of Empowering Plans. I'm Kelly Dempsey with Naga Vivekanandan. Is that right? Okay, yes, all right. Good deal. We are here today to talk about the vaccine, COVID vaccine and testing recommendations and the changes that have happened over the last several months. This has been a lot of buzz in 2025 about the changes that are taking place. So we're going to talk through some of those and go through the different rules, the different recommendations, what that means for plans and different types of plans, as well as what it means for individuals as well. So we'll get started and kind of just dive right in. And I'm going to kind of ask Naga some questions because we've been getting a lot of questions from our clients about this as we head into renewal season with 1/1/2026. Obviously being the start of a lot of new plans. So we'll get right started. So Naga, real softball question. What rules are involved in this update to the COVID testing and vaccines?
So the main sets of rules that we're dealing with here are the ACA preventive services mandate and the rules that expired with the public health emergency, as well as IRS HDHP rules, which we will discuss. We'll get into the nuances of that a little bit more later. But first off, under the ACA, all non-grandfathered plans are required to cover vaccines that are recommended by ACIP, or the Advisory Committee on Immunization Practices, and they are required to cover vaccines as preventive care. Preventive care under the ACA means that the member doesn't pay anything out of pocket when they get the service in network. And that's why during most of the pandemic, people could walk into a pharmacy and get their COVID shot and not see a bill. So it was treated the same way as a flu shot or a childhood immunization. The other rule at play, another important rule, is the special federal mandate during the COVID public health emergency. That required plans to cover basically every single COVID test at no cost, not just the PCR and rapid antigen tests that are ordered by doctors, but even the at-home kits that you could buy at Walgreens. And that was a big deal because normally at-home tests aren't covered by insurance at all. But when the public health emergency ended in May 2023, that requirement ended too. And from that point forward, testing went back to being treated like any other medical service.
Okay, it's interesting. And we know that there's different, like other areas and other topics, unfortunately, having to dissect the different rules and how they apply to different plans can get a little bit tricky. And that's one of the reasons why we're talking about this stuff today. So we've obviously had some evolution this year. There was a lot of chatter starting, obviously, with the turnover in the administration in DC way back in January. But what happened recently related to COVID vaccines?
So this new development is that ACIP changed its recommendations for COVID vaccines. So for the past few years, ACIP recommended the COVID vaccine for pretty much all adults, regardless of age or health status. And that's what made it preventive across the board. Now, ACIP has kind of narrowed the recommendation. So instead of saying all adults should get it, they're now only recommending the seasonal COVID vaccine for higher risk groups who are adults age 65 and older and people who are immunocompromised. And this matters because under the ACA, plans are only required to cover the vaccine at 100% for those ACIP-defined groups. So if you're outside of that group, say a healthy 35-year-old, your plan isn't legally required to cover the vaccine at no cost anymore. Some plans might still choose to cover it broadly, either because they don't want to deal with the administrative headache of limiting it or because they want to be generous. But from a compliance standpoint, the requirement now really only applies to those higher risk groups.
And that's specifically under like the ACA rules, right? That is related to the vaccine. Okay.
Mm-hmm.
So if a plan, there obviously you mentioned non-grandfathered, I heard you kind of slide it in there. So there is a difference between grandfathered and non-grandfathered plans now, still with anything like the preventive care under the ACA, right?
Yes, and this can sometimes get overlooked. So grandfathered plans aren't subject to the ACA preventive services mandate. So that means if you're in a grandfathered plan, technically the plan doesn't have to cover ACIP or ACA recommended vaccines at $0. Most employer-sponsored plans today are non-grandfathered, so they are subject to the mandate. But grandfathered plans do still exist, and in those cases, participants might find that even if ACIP or the ACA recommends a vaccine, they could still face cost sharing. So it's important for employers to know their plan status, grandfathered or not, because that really determines whether these ACA rules apply in the first place.
Yeah. And I know I've said this before, and you probably honestly haven't ever heard me say it because you've only been with FIA for a shorter time, and this isn't something that's come up regularly. But it's a hill that I've always said that, I've been involved in this industry since before the ACA started. And my interpretation and my personal opinion, based on the evolution of these rules and the way the rollout, is that I truly think there were regulators that when they passed these rules, that they didn't think that in 2025, we would still have grandfathered plans, because it's been over 15 years since the ACA was passed. And given the constraints and, just the cost of the world, well, obviously you can account for inflation in the increase in cost and still keep grandfather status. I think that the regulators didn't think that these plans would truly be able to maintain grandfather status for this long. And I know, again, I'm hitting you on the fly with this. You had no idea I was going to bring that up. It just, as we were talking, it kind of occurred to me that that's something that, doesn't necessarily play into COVID, because obviously COVID was not a thing when the ACA started. But I think it's an interesting concept that there still are grandfather plans. Be it right or wrong, there still are. Which is interesting. All right. So does the plan still have to cover COVID testing? I think you kind of answered this, but just to clarify on that piece.
Yeah. The answer is no, at least not in the way people remember from during the pandemic. So when the public health emergency was in effect, there was a blanket rule, which is that all COVID tests had to be covered at no cost. And that included at-home tests, which was really unprecedented. But once the public health emergency ended, that federal mandate disappeared. And now we're back to standard insurance rules. So COVID testing is really just treated like any other diagnostic lab service. So if you go to your doctor with symptoms and the doctor orders a COVID test, it's generally covered, but cost sharing might still apply, depending on your plan. So that could mean a copay for the office visit, co-insurance for the test, or even the full cost until you've met your deductible. And if you're getting tested for work, travel, school, or an event, it depends. Some plans might not cover that at all. It could be out of pocket.
Yeah, definitely things that every individual needs to be aware of before they, obtain medical services, which, again, rules have changed. So the times have changed with it. And it's important to know what you're getting into before you go there, so that you're aware of what your costs are, like any other medical service. All right. So last question that I think I have for you is, do you see this new rule as a bigger impact to plans regarding the coverage or participants regarding access to the vaccine? And I know that's a loaded question.
Well, I'd say, in my view, I think the impact is bigger on participants than plans. So plans are used to adjusting when ACIP changes a recommendation. They already do this for flu shots and shingles vaccines and so on. So from an administrative standpoint, it's just another preventive care update. But for participants, it seems like they're going to feel the change directly. So for the past few years, everyone, regardless of age or risk, could count on the COVID shot being free. Now, if you're not in the ACIP recommended groups, you might walk into a pharmacy and be surprised to find that you have to pay. So that is a really noticeable shift in access. And yeah, for people who are 65 and older, those who are immunocompromised, nothing really changes. It's still covered at 100% for preventative. But for younger, healthier adults, the vaccine might not be free anymore, depending on how their employer decides to handle it. And that change in expectation is where the real impact lies, honestly.
Right. So there's kind of two levels. It's that concept of, what the plan's going to pay, as well as where and how to get it, which we can obviously continue diving into a little bit later. So all right, I'll flip the script and let you ask me some questions, and we can keep diving into this, because this is, I think at first blush some might think that this topic is super easy, open and shut, and it really isn't. It's much more complicated than it appears on the surface.
Yeah, definitely. So the rules, as we were discussing before, are different for PPOs and for HDHPs. So my question is, what does this mean for HDHPs that have to follow IRS rules, and what should employers actually be doing in terms of updating plan documents or employee communications? So that's where I'd love to get your opinion and bring you in. Let me ask you how do you think this rule change impacts HDHPs that are HSA qualified and subject to IRS rules?
Yeah, so I think the biggest piece that would change, and that was with the ending of the COVID public health emergencies, was obviously the testing piece, because tests by definition, testing is not generally considered preventive. It's considered diagnostic. And high deductible health plans that are HSA qualified are required under IRS rules that the only thing that they're allowed to cover at 100% with no cost sharing before the deductible is met is preventive care. So from a testing perspective, once that public health emergency ended, high deductible health plans that are HSA qualified absolutely cannot cover tests at 100% with no cost sharing upfront. They have to charge something for it if they choose to cover it at all. Obviously, you already said that, and that's something that both HDHPs and PPOs can decide is, are you going to cover the testing, and to what degree? It's similar to kind of any other at-home test. Like you noted, this was an unprecedented situation of covering at-home tests that didn't previously have to be generally covered in any way, shape, or form. Now, we won't go off into a tangent, but there are some newer at-home tests related to some other preventive care services that are starting to be covered, but that's for another time and another day. So I think that's the important thing, is that testing is definitely not something that the high deductible health plan can cover without charging something for it up until the deductible is met. When it comes to the vaccine specifically, preventive care, actually, sometimes I feel like there's a misunderstanding of what preventive care means. And preventive care, while it includes what the ACA says is preventive care can actually be a lot broader than just what the ACA requires. So something that is considered preventive in general is still able to be covered at 100% with no cost sharing. So for the high deductible health plans that want to cover the vaccine, they're able to cover it at 100% with no cost sharing, just by definition of the fact that under the broad rules of preventive care, vaccines are considered generally preventive. Now, again, there's still layers that we have to dive through with this. But I think that's the most important thing, is knowing what we have to cover and what we don't have to cover, and the limitations related to testing versus vaccines, and effectively splitting them into two different categories, which they already were. But again, the emergency rules changed the ballgame a little bit. So I think I addressed everything in that one question. So what's the next question?
As someone who's worked in this industry for many years, how would you advise employers on how to deal with these nuances?
Yeah, I think like anything else, the general underlying notion is that decide what the plan wants to do and wants to cover within the guise of whatever rules apply to that specific plan, and then make sure your plan language matches up with that, which again sounds really simple and really easy, but at the end of the day, sometimes isn't. And outside of just the vaccines and testing, we know that there was many different iterations related to language to support coverage for COVID-related situations. So not just the testing and vaccines, but there was also the expansion of timeframes. So the delayed like claims filing, and election of COBRA, and election of a special enrollment rights, the timeframes were widened under the emergency rules. Those all obviously went away when the public health emergency and national health emergency ended. So and they were phased out over time. So those are all done not considered anymore, and we're just left with the vaccine and testing and kind of what does the plan want to cover and not cover within those rules. So it's really, again, the plan, the employer needs to make the decision within, are they subject to ACA? Are they subject to the ACA and the IRS rules? Are they subject to neither because they're grandfathered? Which neither is probably not the right way to say that, but not subject to ACA, but subject to the IRS. There's actually multiple different buckets that they could fall under. So it's deciding what rules apply to them, what they want to cover within those rules, and then making sure the plan language aligns. And I think it's going to be important, like you noted, for the fact that there are different, what the ACIP recommendations are for the vaccine might vary from what the plan wants to cover. So if the plan still wants to cover a vaccine for everyone, that's one issue, and they would just need to make sure that the plan language supports that. Because sometimes now we've gotten in this habit of drafting the definition of preventive care to include what ACA requires. So I think that's where the nuance is that they need to really look into that language and make sure it's supporting what they want to support. And if it is truly, I want to do what the ACA recommendations and the ACIP recommendations are, then you're good. You probably don't have to change your language. But if you want to be more broad than that, you're going to have to probably look at that language and make sure you're covering it. And that's, again, there's still another, I feel like there's another layer there, but I'll take a pause and see if you have any specific follow-ups for that one.
Just kind of as for takeaways from this discussion, what do you think plan sponsors should keep in mind when it comes to communicating this new information to their employees?
Like with any changes under the plan, they're definitely going to need to communicate if they change something under the plan. So it's probably a good idea, especially going into cold and flu season, that communicating what you're doing right now versus what you might do next year for the new plan year or whatever that is. And especially if the employer is changing how they're covering it from this year to next year, it's gonna be important that if they do cover it like this fall, but then don't want to cover it next fall because of the next flu season. Obviously, we anticipate COVID's here all year round, but there's obviously a kick up with like the flu and the cold in the colder months, at least here in the Northeast United States. So making sure that you reiterate as you head into those seasons when people are using those services, what is and isn't covered. I think that's going to be important. I think the other layer here that is the access to coverage and access to the vaccine specifically, meaning, can I go to my pharmacy and get the shot, or can I go to my PCP and get the vaccine? And what does the CDC recommend? And the answer to that one seems like we don't know yet. I think we're still waiting for the CDC to actually make their recommendations. And we know, obviously, with the current state of what's happening, and we don't want to go too far down that rabbit hole, but we're in the middle. We just started a government shutdown. So that obviously limits the functions of what different departments and different government branches and areas are doing during this time, while they're trying to focus on kind of basic functions and operations with the limited staff they might have available. So it's kind of unclear given where we're at right now as to when the CDC might actually issue something. But I do think that people, the general population participants, are going to have to be mindful of the access piece. So, from a human to human personal perspective, if it's something that you believe is right for you and that you want, it might be better to go try to get it now before the potential there's an access issue,
Right.
and they can't get it. So it's tough, and it's yet again a weird situation we find ourselves in. But I think it's going to be, unfortunately, like anything else, evolving, and we're just going to have to see where things take us. And I wouldn't doubt that a couple months down the road, you and I might be back on a podcast revisiting where we're at, because things might change again. Is that kind of how you interpret what, or are there any other things that I missed that you were thinking might be relevant in the situation?
No, yeah, that's absolutely how I interpret it. I think everything is just very up in the air right now. Employers, employees might be very confused with what's going on.
For sure. I feel like we've said that a lot over the last 5 years, that things are evolving, changing rapidly, and you never know what tomorrow might bring. So it's definitely something that everybody's going to have to keep aware and apprised of the changes. And again, communication is key. That if something changes, that employers need to be mindful of communicating to their employees what might have changed under their plan, so that everybody can be educated and on the same page. But until then, this has been great. I think this is helpful. And like I said, when we talked about it at the surface level of trying to decide what we were going to talk about today, it was like, can we really do a whole podcast on this? And the answer is yes. Yes, we absolutely can do a whole podcast on this. There's so many layers when you actually break it down of how it applies. Any final closing comments?
Oh, I don't think so.
All right. Well, thank you so much for joining us today on this episode of Empowering Plans, and we look forward to having you on our next episode.